Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. Just in general, what are the do's and don'ts of telepsychiatry? So you went through the apps not to use.
Right.
And during this time, we're aware that some of these apps that you normally couldn't use are being allowed for use during this time. So I think that's wonderful, because if someone is not that experienced with telepsychiatry, they might be able to use one of these platforms that they're more comfortable with.
Absolutely.
And they might also be able to reach out to their patients and say, hey, are you comfortable with this platform? What about this one? And kind of use what works for their patients. So that's kind of, that's great too. Yeah. But just in general, once you have transitioned to telepsychiatry, what are some of those do's and don'ts when it comes to the communication, protecting privacy, that type of thing?
Yeah. So this is the point I love, because I think I even watched, nurse practitioners adore information. Like, we don't know when to stop getting more information sometimes. I remember watching a webinar recently. It had to be maybe 3 months ago, and it was giving you pointers, and many of them make sense, but they do bear speaking about. When you're in your office and then that's your comfort zone, most of the time our offices have been cultivated to look like and smell like and feel like the way we want them to for our patients, right? They're clean, they're neat. Our distance from where we're sitting and where the patient is sitting has been carefully thought out. There's a tissue box next to the patient. So when you transition to telemedicine, first of all, you have to look at your computer screen and find out where the camera is located. On my Mac desktop, of course, it's located on the top center of my computer. And strangely, when I said to my office manager, let's try out and pretend you're a patient, before we had ever started. And I'm going to open up our telehealth session. And she said, okay, great. So she came on and I clicked on. And for some reason on my computer screen, the patient's picture, it's live, comes up in the upper left-hand corner in about a 2-inch by 2-inch size photograph of the patient. And so naturally, I was looking at her in the upper left-hand corner where her face was. And she said, Michele, what are you doing? And I said, I'm speaking to you. I'm pretending like this is a session. And she said, why are you staring into the corner? Like, it's really weird. And it was like, oh my gosh. She said, is my picture underneath the camera? And I said, no, it's not. And she said, okay, see if you can drag the picture all the way over halfway through the screen so that my picture is right under the camera. And I was able to do that. I'm so proud to say, like, all by myself. She didn't have to come in. And then I was like, oh my gosh, how about now? And she goes, now you look like you're talking to me. It was really strange at the beginning. So that's one of the basic things. We're so in tune to looking at our patients, right? We give them our total attention. But if we're looking into the corner, even if we are looking at them on our computer screen and they don't know that, they're going to be too embarrassed to say, like, why are you looking in the corner? It reminds me that, at one point I had Invisalign braces, and I don't know why. I was chewing on a cherry red Lifesaver. And after the entire intake, I went to look in the mirror and my teeth were completely red with the Invisalign. And I thought, oh my gosh, that lovely patient didn't say a word. I literally I chased her to the parking lot, and she was a nurse. And I said to her, listen, if we are going to get on, you cannot let me have a red mouth, like red teeth. Just because, she goes, I wasn't sure if I should say something. And I said, well, if you want me to say something, if there's something on your teeth, then you have to say something when there's something on my teeth. That's just general, like, we'll get along perfectly. And it was a great time. She was laughing. And she said, okay, I promise to tell you next time. But there are things like that you have to think about. The second part is make sure that what your camera sees is what you want it to see. So basically, when you're doing a telemed visit, patients, and I was noticing my terrible posture today. I definitely hunch over, and I was like noticing, wow, I really do slouch. Patients want to see you looking the same way that you do when you're at the office, because if you look haggard and your hair is astray and, like there's just white walls around you, they're going to be like, oh my God, this thing is worse than I ever thought. Like Michele usually looks put together halfway, and she looks like she just stepped out of I don't know what. And so I do make an effort to sort of like, at least look just the way I do at the office. And that's, it might not be dressed up, but a nice shirt. I do wash my face and wash my hair, and if I want to wear pajamas from the waist down, that's just a secret between you guys and me. No, but just to be comfortable, but just then I can't stand up. Another thing is I actually have my laptop set up next to my desktop because I do e-prescribing. So before I move on to do the e-prescribing, I warn the patients. I'll say, I'm going to break eye contact right now because I'm going to pull your name up on my laptop. So just so you know, I'm not looking at you because I'm pulling up your profile on our e-prescribe system, just so they have an idea of what I'm doing. Yeah. And then, for me, I end up printing out whatever I e-prescribed, and then I take my phone. It might be overkill, but that's who I am. I take a screenshot of the actual meds I prescribed, and I text it to them so they have proof of what I prescribed. And any other directions, I'll say, call Corinne and make an appointment for 2 months, or certainly sooner if you want to. And today was a high compliment because 2 patients said, are you sure you're not in your office? Because it looks exactly like your office from behind where you're sitting. And of course, I thought I had very unique decorating style, and apparently I don't, because patients thought they were back. I was in my office. I have different pictures, but obviously there's still pictures of flowers. So I think that's comforting. For me, I've noticed over the years that patients do not like it when I change the decorating in my office radically. They're like, you changed your office again? And so right now, I don't want them to think I've done anything different. I'm not changing the color of my hair. And literally, my countenance has to show them that this is going to be fine. We're going to get through this. I do feel that this is going to pass us like so many other things we've gone through. And I run through really quickly some basic hand washing and what the latest recommendations are and what the symptoms are in case they do get sick. And also, some patients can't get a hold of their primary care providers because they're so overwhelmed that they have. I had one patient who had sinusitis for 3 weeks. And he's like, can I ask you for a Z-Pack? And of course, I was like, tell me about your allergy history. Have you ever had an allergy to anything? He's like, oh my God. And I was like, all right, I'll give you a Z-Pack, but like, call me in 3 days. If you have any, petechiae, or God forbid you have a rash, you have to let me know immediately. And he's laughing. He's like, Michele, you're just so over the top. But yeah, people are having a hard time sometimes getting in touch with their providers. I will not do any COVID-19 screenings, of course. There are so many other venues for that. And I think that's important for me to, to say that we don't do that. And some patients need their medications increased for now, and telling them that that's okay. One of my messages is, honestly, nobody gets a gold star for white knuckling it through a very stressful time that we have no frame of reference for. None of us have ever done this. At least I haven't. I've never had to deal with being in the house with my family. I love them though I do, but this is unique for me. And like, they're all outside having fun and throwing water at each other. And I'm in my office. I love it as much as I do, but I'm just like seeing patients and writing notes and calling in prescriptions. And they're like, you seem cranky lately, Mom. And I'm like, just, leave me alone. Somebody has to work. Why not? Might as well be a martyr if I have to be. But, this is very uncharted territory. So I always reassure my patients, especially the ones who were supposed to be titrating down, potentially off some meds. I have a patient who has a certain type of cancer, and she's had incredible, intractable anxiety. And her Xanax XR, I was hoping to start to have her titrate down. She's not on a horribly high dose, but she was so upset that she couldn't do it right now. And I literally had to talk. I was like, seriously, do you think that, number one, you're not upsetting me? Your health is most important. And you have 2 teenagers at home. like, God bless you. If you want more, we'll have to do that. Which I wasn't really, she was laughing. But I said, the last thing I want you to worry about, trust me, on the back burner, is that I'm not going to give you the right amount of medication for now, right? I'm not going to up your doses times 2, but absolutely, now is not the time. I wouldn't even let you if you wanted to. I would tell you that now is not the best time for us to do it. And so she felt relieved. So basically, look at what's behind you. Make sure you're dressed appropriately from the waist up. Patients really do take their cues from our countenance, right? Like, how patients, if you're looking off or you're looking concerned, they know it. They just know it. So I've been making an effort to have a relaxed facial expression. And they know me to be jokers, so sometimes I'll make some jokes about their kids or whatever, because they need a joke. I'm not funny, but they seem to laugh because they're probably just bored silly. So that's worked out too. So maybe I have a second career when this is all done. Stand-up comedy. So they're all shaking their heads going, no, don't do it. But, make it look warm and inviting behind you. Don't have any, luckily I have a home office with a door on it. I have a curtain that doesn't let anybody see in. I have a noisemaker, just because if I want the patient, I tell them, you can put headsets on so that nobody can hear me, right? And the old-fashioned headset, which is the plug-in, is fine. And sometimes, like if I think there's one of my kids is in the next room, I'll put on my headset as well, right? And the patient can see that. And I said, this is still private. I don't want anybody else hearing what I'm telling you, because that's important to you. Right. And I don't want anybody in my family hearing anything that we discuss. But again, just making sure that your patients have a couple of means of reaching you or reaching your office. I always believe healthcare providers, we always have the best intentions. I've been blessed to work with so many amazing people. My office is right near Sandy Hook, and the day after the Sandy Hook shootings, which were so horrible, there was an ad hoc triage team that I was a part of at one of the local schools, and we had nothing. There was no Red Cross. They don't come for a few days. And literally, I just want to mention that at least 250 psychologists and trauma specialists and therapists came from as far away as southern Pennsylvania and even further, just to come and offer their services if we needed them. And of course we did. So I just know that we didn't go into this field because we thought it would be easy or it would be a piece of cake. We took care of so many people. There were so many amazing providers. Of course they were not looking to get paid. They just were like, how can we help? There's so many people who are experts in trauma. And I just have a strong belief that we always want to do what's best. Even if we were in this for the money, we made a mistake. So, and leave on your voicemail. What should a patient do if there is an emergency? Obviously, the crisis hotline in your state is important. There's the suicide prevention hotline that you might want to actually put on your voicemail. Implement a plan for group practices. I know that at the end of the day, I get a group text going with all my other providers, and I sort of ask if anybody had any problems that they want to talk about, and I just sort of give them so much appreciation for the hard work they do. It's amazing. They're willing to take patients. One of our other providers has been sick with a hernia, and so all the other providers are like, yes, please do give us her patients. We're happy to see them. And the last thing, I do want to mention, remember, and we all hear this, but we're all terrible at it. Make self-care a priority, right? I'll say it again. Make self-care a priority. Dr. Siegel, we were laughing about how we were eating potato chips earlier today. I never eat potato chips. And so I don't know what day of the week it is, and I usually go to the gym certain days. So figure out how to work out at home. Like there's all sorts of YouTube apps, and all of my patients, I say, now is a perfect time to get 8 or 9 hours of sleep a night, because it will perk up your immune system better than any vitamin C in the world will. And they're always happy to hear that, because really, we are so sleep deprived. If you have a bad connection or you're not sure how the connection is, please do make sure that your room is lit so that the patient can see your face, and if need be, they can read your lips. Because sometimes if you're speaking too quickly, they cannot see or hear what you're saying, right? So I make sure that when I'm not sure about the connection, their picture might be fuzzy, I make a special effort to speak extraordinarily slowly. I try to articulate as best I can, right? And that seems to be important. And the lighting, if there's overhead lighting, that doesn't work very well. It makes it look like your head is in the sun. And so my daughter helped me figure out how to put like one of those up lamps so the lighting is softer.
Oh, that's great.
Yeah. And most of us in the country speak very quickly and we don't articulate. And so this is a great, time for me and all of us to slow down, articulate, make sure that the patients have heard, because they're so lovely and so remiss to hurt our feelings that sometimes they don't want to actually say, I don't know what you just said. Right?
Right.
Yeah. So sometimes there's a lot more meta communication, or I'll say to the patient, it's okay. Did you hear what I just said? Because I don't mind repeating it. Right. Mm-hmm. And they'll say, oh, thank you. No, I did not hear a word you said. Yeah. And so then I just repeat it and that's okay.
Yeah.
And that part, let's see, warn them when you're going to be out of view.
Yeah. These are excellent. Thank you so much.
Yeah. This is the fast track for telemedicine. Yeah.
And that leads me to my next question. You touched a little bit on this earlier, but how do you manage insurance or billing within the scope of telepsychiatry? And if most of this we need to put in the show notes, that's fine too. If you want to just kind of give a little summary.
Yes, very briefly. My office manager and I spent probably $200 on a webinar. That was 4 hours of boring on how to bill for telemedicine. I fell asleep, but she took notes, thankfully. And honestly, there's literally only 2 places on the bill, if you guys are doing your own billing, that are different. There's a modifier that needs to be used, and I wish I could tell you what it is. I think it's different for different insurers, right? Like Anthem is different than Aetna's. Mm-hmm. And also you have to fill in a number for where the place you saw the patient was. But there's no restrictions. So in the past, you wouldn't have been able to say you're home. And again, Dr. Siegel, you were going to make available, it's extraordinarily long. CDC.gov has the ICD-10 official coding guide, interim advice coronavirus, put out on February 20th of this year. And it's a link that looks like you can print. And I did not print it yet, but you guys will have access to that link. And it's probably worth your while to do that because it gives you all the links. It gives you the basic without having to, you don't need a webinar to go ahead and bill. Mm-hmm.
Mm-hmm. Excellent. What are some of the technological challenges to treating patients who might not be as tech savvy? And what do you recommend to overcome these challenges? So especially when it comes to COVID-19, we're seeing a lot more of the older population being impacted by this.
Yes.
And not to put any major assumptions out there, but this tends to be a population that struggles a little bit more with technology. How do you address that?
Right. I struggle with technology. But sometimes necessity breeds innovation. And first of all, I know that my office manager contacts the patient to tell them that we're going to be seeing them over telepsychiatry. She asks them, what kind of a device do you have at home? Do you think you'll be doing the visit with your iPhone, which all the teenagers and young adults seem to do? I don't know why. Do you have a tablet or do you have a desktop? Because depending on which of those 3 is the way she will deliver the email, let's say. So if they have a desktop, she'll say, we're going to send you an email about an hour or so before the visit. That email has a link, which is basically highlighted letters with a line under it. You're going to click on that link, right? And it's going to ask you, is this, Mrs. Jones? It may ask you to verify if your insurance is still the same, Aetna or whatever. And sometimes for patients who haven't met their deductible, for instance, it may ask, do you have a form of payment like credit card so that we can charge your copay, because the copays and deductibles still do apply. And I will say this, because I'm not a volunteer, this is a business I run. Getting the payment the day you do the visit is extraordinarily important. If you let it go and you I told all my peers, all of you, unless you want to do this as volunteer work, have a responsibility to make sure that your patients understand that giving us a credit card does not mean that we're all going to go out and buy Victoria's Secret underwear. It's not going to happen, right? Like, all we were going to do with it is we will charge your copay. You will see that on your receipt that we email you immediately. And if it's contested or we made a mistake, of course, we give you the benefit of the doubt and credit you. But once you let the patient go, the chances of getting the copay are 35% less. And that's whether the patient's in your office or on telemedicine. And you know what? Patients are so good about it because they know we're acting in good faith. We don't rush them through the visit. And if they have an extra question about, I sneezed 3 days ago, do you think I have it? They know that I'll take the time to answer it as best I can, and I try to do some teaching as best I can every time I talk to patients. So that's number one. Number two, if they do it on a tablet or an iPhone or a smartphone, my secretary will send them instructions. You will get a text and it will tell you to download Cario Telemedicine. Download that app, and when you go on the app, you'll open up and make a username and password. Everybody in the world should know that everything needs a username and password, right? Mm-hmm. I don't know why. We don't ask you if you're a robot. We don't ask you to identify pictures where there's cars or no cars, or can you decipher these 6 letters to make sure you're not a robot? We don't do any of that. We just want you to make a username and password. And then you press a button when you've done that, and you'll literally see a circle on your screen, which means that you're in the virtual waiting room. And within minutes, I will click on, and if it takes you a few minutes to get your headset on or to come out from the bathroom because you were in the bathroom, I won't hang up on you. I'd rather you take your time, get comfortable, and I will wait. And I repeat that all the time. Please, if you are in the middle of something, I have nothing but time. So, get your headset or go into the other room if that's what you prefer. And once they do it, there's actually a sense of mastery. And so that's been exciting to see for the older adults, because I praise them. I'm like, wow, you were able to do that by yourself? Like, there's no young adults in your house to help you? And they're like, nope, I did it myself. And I'm like, oh my gosh, I'm very impressed. It's tricky. As we do with all things in psychiatry, being a cheerleader for your patient always works well, because it is a feat for them to be able to log on and have success. And as I said before, if they don't have success, you text or call them and you say, it's not a big deal. It really is fine. And maybe Corinne next time can explain it to you in a better way. Or maybe we can try your phone instead of your computer. No big deal. The bottom line is that we got to see you one way or the other, over the phone or over the telehealth app.
So my final question is, what would you say to someone who is apprehensive to try telepsychiatry?
So basically, you can either be pushed off the cliff, which is where we are right now, and continue your practice, because I will say I am so desperate to find out which therapists have adopted telehealth capabilities, because I want to refer patients to therapists. I prefer to have my patients overseeing a therapist. So I've been calling some of them and saying, do you have telemedicine? If you don't, can you try these couple of things and maybe you can, figure it out? And if they do have it, I'm so happy. And I'll say, I'll definitely try to send some patients your way, obviously appropriate patients. And I've also told other therapists, I'll be happy to take new patients, because that is also now acceptable, as it was not before on telemedicine. But this is the perfect time if they want to continue their practice, if they want their patients to be able to see them. I know providers worry about their patients, and so it will lessen your own anxiety about what's happening with them. if you have a means to communicate and see them. It will make you feel a huge sense of mastery. And my office manager threw in, you won't have to, lay off your office staff should you have them. Because if you're still doing business and there's still people being seen, then we still need our office people, and not lending to so many people who are sadly getting laid off is part of what we can do if we are able. So I would say this is the perfect time. You don't ever have to do it again if you don't like it, but it's a nice skill to have in your toolbox.
Absolutely. Mm-hmm. Well, thank you so much for all of this very helpful and timely information. And thank you for being on the show.
Thank you so much, Dr. Siegel. It was such a delight to speak with you. I hope that many of you continue to take excellent care of your patients, because I know that's what is in your heart. And I hope it was helpful for you today. Thank you.
This NEI podcast episode is brought to you by NEI Max. Given the unique circumstances of this year, our spring and fall meetings have been combined into one super psychopharmacology meeting. Join us for an experience like no other and get ready to be educated, invigorated, and empowered to improve the lives of your patients. Learn more at nei.global/NEI Max.